All right. Just wanted to show you guys two different types of Jaeger DLCO regulators. Notice there's a couple of differences. The one has the newer model has a braided hose. It also, as we turn it, you notice that it has this fluted ring that's now attached to adapter, and the older model just had a single piece. Now this older model could be a problem if it wasn't sitting on tight, and we know that sometimes patients grab this, and if it's put back, it's sometimes not put back snugly. But I want to focus in on the newer one because this introduced a whole new problem. Notice this tiny little set screw. It's an Allen head wrench, 1.5 millimeter set screw. And what that does, it was necessary, I think this is Jaeger's recognition that this could be a problem if the adapter, which fits onto this end, becomes loosened from the DLCO regulator itself. You can get a leak actually right here in through the threads. So this can be fitting on snugly. This looks okay, but it could be entraining room air while the DLCO regulator is actually making a sound, and it seems like the patient's breathing in. The rest of this we're going to present to you is screenshots that happened as this thing did bite us on the butt, and I want to make sure it doesn't happen again. So one key point is to make sure that when you have this thing assembled, that this adapter and this fluted ring are screwed down as snugly as possible. And when that occurs, you need to take advantage of it being tight and tighten up this set screw with a 1.5 millimeter hex head wrench. And once that is set in, you're essentially screwing this into the same threads that were used to connect the DLCO regulator to the adapter. And now this is not turning and you can't leak. So we'll talk to you about how to pick that up, evidence of it post-test. You can look at the reanalysis screens and you can determine whether or not your patient's results actually were a problem. So more on that later.